Hello, Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you have requested. The area of interest is the upper right fold 5, and we've done a high resolution endodontic mode X-ray for our doctor. Now, this is the axial view. On the axial view, we can see that the chamber has been opened. Now, we're assuming this is a re-endo treatment case. As we are moving apically, you can see that there are two canals. We've got slight obturation material in the isthmus. As we move further down, the two canals have been cleaned out. Right at the apical 1/3, we can actually observe that the buccal canal has, even though has slight opening, there is still obturation material stuck in the apical 1/3, and that is where there is no opening now at this point, and hence we will assume that the apex has not been crossed in the buccal canal. The apex might have been crossed in the lingual, in the parietal canal, which we can see right here. But we are assuming that the apex and the buccal canal has not been breached. There is a periapical radiolucency in this tooth that you can see here. When we look at the tooth from a transaxial point of view, you can see that this canal has crossed the apex, whereas this canal still has obturational material stuck in the apical 1/3, and this is where we see the periapical infection. So this is how the situation is. Your working length estimatedly for the parietal is 17, and for the buccal is going to be 18.5. So there's going to be a 1 millimeter difference between the buccal and the parietal. When we look at it from a sagittal view, you can see this is the buccal where we have this area which is not crossed, and when we crossed was this is the parietal, and now this is the buccal canal, and you can very clearly see that the parietal canal is completely clear, whereas the buccal canal still has some material stuck here, and this is where we can also see the periapical radiolucency. We don't see any major cracks. We don't see any of that at the moment, but we will continue to look for signs of any crack or fracture in this tooth. Thank you very much.